Hello, my dear students. It's me, Menopause Barbie, your menopause tailor, and I'm back to school you on yet another matter pertaining to menopause. You know that I cover everything, and most recently I presented a huge unit on heart attack, followed by a huge unit on osteoporosis. In both instances, you discovered that while these two diseases are extremely common in menopausal women, the awareness of their incidence, knowledge of their symptoms, and prevention of their devastating effects are greatly lacking. You learn that this is true for both the women themselves as well as it is for the medical communities and professionals that are available to support these women. So this little unit is what I call the neglect series. And this particular video will address menopause as a public health issue. You should watch this video to get a global perspective of just how severe the neglect of menopause really is. And that will induce you to do what's necessary to make up for the oversights. So let's start, as usual, with the definition of public health. Public health is the science of preventing disease, prolonging life, and promoting human health through organized efforts and informed choices of society, organizations, communities, and individuals. Public health takes into account physical, psychological, and social well-being. So let's dissect that definition a bit, and then we'll apply it to menopause. The first part of the definition pertains to the goals or objectives of public health. Take a look at that definition again with the objectives in bold. Public health is the science of preventing disease, prolonging life, and promoting human health through organized efforts and informed choices of society, organizations, communities, and individuals. So the three objectives are preventing disease, prolonging life, and promoting human health. Let's see how well these public health objectives are succeeding with regard to menopause, using just the two diseases we've discussed thus far. Let's start with the first of those objectives, preventing disease. You've learned all about the state of affairs for heart attacks and osteoporosis in menopausal women. Heart attacks kill 1 out of every 2 menopausal women, and osteoporosis affects 1 out of every 4 menopausal women. In both units, I presented all the options for preventing both diseases, and they constitute a vast smorgasbord in a wide variety of categories. But alas, there are still no adequate efforts to prevent these diseases in menopausal women. You saw that women and medical professionals don't even know how to recognize a heart attack in a woman. As a result, when a woman has a heart attack, she may not even seek medical care. If she does, she's likely to be misdiagnosed with indigestion, and she is very unlikely to get the necessary tests to diagnose the heart attack, and therefore, she does not get the medication or procedures to prevent a second heart attack. Because of all these things, most women who have a heart attack die from it. And all the resources for osteoporosis are aimed at treatment rather than prevention. Instead of warning women that estrogen loss causes bone loss, women are told that calcium prevents or treats bone loss. Instead of designating the time of estrogen loss as the time for your first bone density test, the guidelines tell you to wait until you're 65. Instead of designating estrogen replacement as the most logical way to prevent bone loss, the guidelines recommend against it. And instead of designating early bone loss as the time to take non-hormonal medications, the treatment guidelines recommend waiting for a frank osteoporosis, or a fracture. Not one of these things focuses on prevention. They all focus on letting women develop severe life-threatening conditions before any action is taken. And we haven't even addressed the other diseases associated with menopause yet. But you can already see that the objective of prevention has not been successful or even attempted. How about the second objective, prolonging life? If women are having heart attacks as a result of losing their estrogen at about the age of 50, and they don't know that heart attacks are a consequence of losing their estrogen at about the age of 50, and they are not learning how to compensate for that estrogen loss in order to prevent a heart attack, and if 1 out of 2 women dies of a heart attack near the age of 50, that is a failure to prolong life. And if 25% of the women who have osteoporosis sustain a fracture that results in fatal consequences, that is not prolonging life. So the objective of prolonging life has not been successful either. What about the third objective, promoting human health? Most of us think of health as feeling good and functioning normally. When you start experiencing all the symptoms of menopause, do you feel good? Do you function normally? What about when you have a heart attack or when you sustain a fracture from osteoporosis? Do you see how this public health objective has failed also? The second part of the definition addresses the means of accomplishing the public health objectives. Here's the definition of public health again with that part in bold. Public health is the science of preventing diseases, prolonging life, and promoting human health through organized efforts and informed choices of society, organizations, communities, and individuals. So the way in which public health seeks to achieve its objectives is through organized efforts and informed choices. So let's address those in turn. How many organized efforts are there for menopause? Do you know of any support groups? What about educational resources other than advertising and marketing ploys? Have you ever encountered any other truly educational resource on menopause other than the one I provide for you here? The fact is, there aren't any. There are various books written by physicians defending their own preferences for menopause management in their own patient populations. And of course, they include some educational pearls, but only those that support that particular physician's practice style. And of course, there are plenty of people pretending to teach so that you buy their product. These range from salespeople to celebrities to alternative gurus. So public health has failed to provide the means of educating you or the means of preventing diseases, prolonging life, or promoting human health. What about enabling you to make informed choices? How able were you to make informed choices before finding my channel on YouTube? What other resources help you make informed choices? How much of what you previously would have chosen for managing your menopause was based on fear? How much of your information was factual rather than fearful? Most women don't really choose anything. Most are just so paralyzed with either fear or denial that they just do nothing. So public health has failed at providing you with the ability to make informed choices. Now let's look at the next part of that definition. Here it is highlighted in bold font, and it pertains to what I call the players. Public health is the science of preventing disease, prolonging life, and promoting human health through organized efforts and informed choices of society, organizations, communities, and individuals. So Public health is supposed to accomplish its objectives by utilizing or targeting societies, organizations, communities, and individuals. Can you name any menopause societies that are for laypersons? I belong to a few that are for professionals, but those professionals are not passing the information on to you. What about menopause organizations? Are there any organizations like Alcoholics Anonymous for menopausal women? Are there any community services for them? You are the individual mentioned in the definition. How much has public health done to support your menopause? I would say that it's failed miserably in utilizing or targeting all of these groups. And now let's take a look at that add-on statement in the definition of public health. Public health takes into account physical, psychological, and social well-being. It claims that public health takes all of the following into account: physical well-being, psychological well-being, and social well-being. Would you say that the state of menopause is one in which you and other menopausal women are supported with regard to their physical, psychological, and social well-being? Public health is supposed to address all the things that affect the entire population. It includes things like education on the harmful effects of smoking and making sure everyone wears seatbelts, air pollution, the opioid epidemic, obesity, the influenza pandemic, and the list goes on and on and on. Generally speaking, public health issues are the things that have a huge impact on large numbers of individuals, such that they threaten the quality of life of a large group. So I ask you, why isn't menopause on the list? Menopause is a condition that affects half of the world's population directly, and the effects last for a full 1/2 of their lives. But the effect goes beyond the individual, and that's because there are so many menopausal women that there is not one single human on earth who does not have at least one menopausal woman in his or her life. This means that it affects more than just the population of menopausal women themselves. It affects everyone in her family, and if she works, it affects the workplace. It also puts a huge monetary strain on the economy in terms of the costs of treating the diseases that are associated with menopause. Those diseases, heart attack, osteoporosis, and Alzheimer's, are fatal. If any other disease had as many far-reaching adverse effects as menopause, it would be on the list of public health issues. So why isn't menopause listed? Why is it excluded from the list? This comes back to the title of this series, the Neglect Series. How is it that nobody has thought to put menopause on the list of public health issues? Well, it's because nobody thinks about menopause, period. It's just not on the radar. And yet, unlike the other items on the list, menopause will absolutely and inevitably eventually affect every female on earth. This is a huge oversight, wouldn't you say? Well, because it's not a public health issue, all you've got to support you with regard to your menopause is me. I'll provide the education, help you tailor it to yourself, and explain the options for management. I'll also help you prevent the diseases, prolong your life, and promote your health. I'll do it through my organized efforts to make sure you can make informed choices, and I may not be an organization, but I can still take into account your physical, psychological, and social well-being. Your job is to watch the videos in order, or read my book, or watch the webinars, or get a consultation, because I'm all you've got. Public health has failed you entirely on this matter. That is just the unfortunate truth. Okay. Okay, ladies, I'll bid you goodbye for today, and next week I'll talk about the tree of menopause. For consultations, schedule at menopausetailor.me, and to follow me, go to Facebook, Twitter, and Instagram, and to subscribe, click subscribe. I will see you in a week. Bye.